Hello, we are introducing the 2021 Scripps Health ransomware attack. My voice did not record, so this was dubbed over.
Yeah, so in the slide, we have the introduction to Scripps, kind of a brief overview of the company. We have an event timeline, so the timeline of the initial attack that first week, and then the aftermath and effects. Our related work focuses on some attacks previously on Scripps. We have some preliminary results from the investigation so far in our project, and then our team member responsibilities and how we're moving forward with the project.
Just a brief introduction to Scripps Health is that it's a nonprofit healthcare system based in San Diego, California. It was founded in 1924, and an important aspect of it is that it specializes in primary care and specialized treatments such as cardiology, oncology, and neurology, and those will be important for the story of their hack.
Yeah, so if you wouldn't mind clicking, perfect. If you could go back to that, perfect. Yeah, so the first attack happens on May 1st. That's where Scripps has their outage, and it disrupts their IT systems and facility systems. So that's when they start their independent security firm, but they begin an investigation to see what's going on. That next day, on May 2nd, is where they officially confirmed that they were victims of a cyber attack. That their servers were hacked overnight, forcing all their systems to go down. So in the next couple of days, their systems are still down up to May 5th and 6th, where you're starting to see some of the prolonged repercussions from not having care. Patient services are getting messed up. They can't log into their portals. They don't know what's going on, and Scripps is kind of keeping everything a little mum. San Diego County's healthcare providers are also seeing an uptick in people moving away from Scripps to their services. And then on May 7th, you get the official confirmation of a ransomware attack from the California Department of Public Health. And they don't know at the time who is behind it and how much they're seeking a ransom for.
And then continue on from that timeline. It took Scripps about a month from the initial attack to see a return for their initial system processes. It also took them about a month to estimate have an estimate of 140,000 patients that are affected from the said breaches. And then from June 1st to December 27th of that same year, multiple class action lawsuits were beginning to roll in on behalf of the patients that were affected from this breach. And from there, the Scripps Health, they gave out a $3.5 million settlement to help compensate for those victims. But then that next year, March 2022, a second notification of affected patients were beginning to be sent out that also had their information obtained from this breach. Then on September 7th, 2023 of this year, there were nine criminally charged people that were responsible for the ransomware attack, one of them being Maxim Glochkin, a Russian national, who is one of the 9 people that were charged for this crime that used TrickBot and accounting ransomware.
Oh, okay. I'm gonna cover related work, and to keep it simple, Scripps Health has been compromised before. It got compromised in 2015 by through their third-party billing service, and that compromised 2,500 accounts for their patients, including social security number, phone number, addresses, medical history, etc. And then they got further attacked in 2019 by an attacker that was doing phishing attack. So the attacker was targeting employees of the company, hoping they'll press on a link, open a document, open something, and that'll give them access uh, to the to the company. And that's the related work.
Okay, so for the preliminary result of the attack, The Scripps Healthcare Network was composed of about 5 acute hospitals, and because of the attack, the operations and other acute emergency stuffs have to be delayed, which sometimes means a life or death. And also for the research and investigation, researchers also investigate the ripple effects on other hospitals in the area, and they have concluded that this kind of emergency response should be a standard practice in the industry because the cyber attack going to be more prevalent against hospitals.
As my other group members have said, Scripps has been vulnerable in the past and may need a better offensive and defensive plan of action. For the red team, we will research the practices that fail to protect the company's data from the attacker gaining access and use this to define an offensive plan. For the blue team, we will research the recommended practices for the mitigation of these types of attacks to avoid immense disruptions and use this research to define a more standard plan of action for healthcare companies to use in the event of a data breach.